County is going to have to wait just a little longer for the Pfizer COVID-19 vaccine. Shipments were supposed to be delivered on Tuesday, but we're told they were delayed. They're now expected to be here tomorrow or even Friday. The first round of the vaccine will be given to healthcare workers who operate directly in contact with COVID-positive patients, along with those in long-term care facilities getting the first round of doses. The Pew Research Center conducted a survey to find and found that 40% of Americans are unwilling to take the COVID-19 vaccine once it becomes available. 23 ABC's Kristin Vartan joining us live from Memorial Hospital this morning to address some of the misconceptions surrounding the vaccine by talking to the experts. Kristin?
Mike, with anything new comes uncertainty, and with uncertainty can come misconceptions. And with some Americans concerned about the safety of the virus due to its quick turnaround, local experts are weighing in to set the record straight.
I feel pretty confident that this vaccine is safe. What we don't know is how long it's going to last. Do we need to get another booster, in 6 months? Or is this going to last for a lifetime of COVID?
But here's what we do know. Almost 44,000 patients have tested the vaccine prior to its distribution, the effectiveness being 95% after 2 doses. Adventist Health Bakersfield spokesman Kiyoshi Tomono says it's a larger sample size than in previous vaccines, balancing out the emergency authorization timeline.
Get it. So if that's in any way a reassurance for people at home that the doctors themselves who kind of are on the front lines are willing to get it, I hope that it is, kind of encouraging.
Another concern among the public, infertility. Dr. Kothari says the vaccine so far has not negatively harmed the dozens of pregnant women from the trials, but adds that Dignity won't vaccinate anyone pregnant. And as for myths of altering of DNA and actually getting COVID from the vaccine,
they did have a few cases of people that did get the virus. However, those cases were minimal in terms of their symptoms.
It's not an actual virus at all that injecting with this vaccine. It's molecular material that elicits a response that's specific to a protein. It's actually those proteins on the outside. We look at the ball of the virus. That's what the mRNA is specific for. Your body produces a response to those and now recognizes those proteins as foreign, and now you've built out an immunity.
But possible side effects.
You will get some arm soreness. That was the biggest side effect that most people had.
Dignity Health and Adventist Health won't administer their vaccines all on the same day, in case anyone does experience common vaccine side effects from the trials like headaches and body aches.
When you get the vaccine, like any vaccine, the flu vaccine, you may feel a little puny the next day, but that's a normal part of the immune response that your body's building.
Even with that immunity, the myth circulating that vaccinated individuals don't have to wear a mask anymore? Dr. Kothar explains this is not the case. Mask wearing, social distancing, proper hand washing, these are all safety measures the CDC has been saying all along. He believes we should still follow them.
We do our part. We can prevent something that I think could be really disastrous for the month of January.
Now, both hospitals conducted surveys with their staff to see who would take the vaccine within that first round. Half of them said they would not take it, but might take it in the second round. And Dr. Kothari says no one has to take it if they do not want to. Live at Memorial Hospital, Kristin Vartan, 23 ABC News, connecting you.